Pick up your phone or jump on the internet. You direct the show with your questions. You may ask anything tonight on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. I'm Dr. Deb Johnson. Dr. Holm is away this evening. Tonight, we open up our topics to whatever medical questions you have. It is the first Ask Anything program of the season. First, let's take a look at this week's Prairie Doc quiz question. Name 3 of the top 10 medical conditions for those older than 65. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of Dr. Holm's essays, originally written for this show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We will announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in. We answer your medical questions as they are called in or sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen. And joining us tonight from Redfield, South Dakota is Dr. Matthew Owens with Community Memorial Hospital and Redfield Clinic. Matt, thanks for joining us tonight.
Thanks for inviting me.
Tell us a little bit about your background.
I moved to South Dakota in 1982, went through undergrad and master's work down at USD, went to USD School of Medicine, and graduated from what was then called the Rural Training Track right here in Brookings. And since then, I've practiced in Redfield 19 years. I think it's getting to be about 19.
Wow.
And it's been quite an pretty enjoyable career. Been a lot of fun.
Yeah. Primary care is a great place to be.
Yep.
Yeah. So let's see if we had no questions yet, people. Don't disappoint me. Come on, get us some questions. So I know that we're going to talk a little bit about disaster relief later tonight. Let's talk a little bit now about, what do you think? Should we talk about the different roles in the healthcare setting?
Sure, but I think we ought to focus more on our listeners at this point. A couple things I believe they should do is let's get to the South Dakota Department of Health website. They've got really good factual information on there. And just little things to think about for our listeners. One of the big tragedies, and when we teach this at the university, we talk about big D disasters like a Katrina or an Irma, and little D disasters where you say your house is on fire. One of the things that's every year that's in the newspapers is where a family doesn't have a plan when the house catches fire for where to all meet. So somebody goes back in looking for somebody when in fact they're safe, and then unfortunately that person dies from the fire. Just little things like that, I think our viewers should be kind of have a plan. Families should have a plan on what to do to get out of a house, to get out of whatever situation they might find themselves in.
A little bit of thought ahead of time can be extremely valuable. You know, it's really unlikely that those of us here in South Dakota are ever going to have to deal with a hurricane here, but we have tornadoes, we have fires, and we have blizzards. So even if we're not likely to have those large-scale disasters affecting millions of people the way they do in other states, we still have to be prepared on our own basis to manage by ourselves for 3 to 4 days.
Absolutely, and just basic things like that we're seeing with Hurricane Irma, just having a water supply, food supply, and very important, especially with folks that have chronic medical conditions, is have a supply of those medications available so you do not, in case of a blizzard, you may not be able to get to the pharmacy. Backup generators and having a contingency plan. I have a number of patients that are on home oxygen, and when they lose their electricity, they've only got an hour or two of battery time. Those sort of things need to be thought out well ahead of the actual incident. Absolutely.
Yeah. Very important information.
And keep your immunizations up to date.
Oh, yes, definitely. Your tetanus immunization. You should have a tetanus shot. How often, Dr. Owens?
It depends who you want to read. I think at a minimum 10. Yeah.
How about that pertussis shot?
Right along with it. Yep, absolutely.
And what other shot should we be pushing right now for people?
One can never overestimate the effect of influenza vaccines.
Oh, goodness gracious,
It's
I
the
agree.
biggest bang for the buck in modern healthcare. And if you don't get it for yourself, I know a lot of the patients that I see in the younger age group, influenza is not that big a deal. But once it gets into the more elderly, the nursing home, the long-term care setting,
Or the young.
Or the young, yeah.
The young kids.
We have about 30,000 deaths a year, any given year, due to influenza. It's not a minor thing.
No, it's not. And as you said, even those people that are generally healthy, 30-year-old, perfectly healthy guy, you may have children. You may have grandparents, great-grandparents. The guy that works next to you at your job may have a kid who's immunosuppressed, who doesn't have a good immune system for cancer treatment or whatever. So you're not getting the shot just for you. You're getting the shot for everybody around you, and it's really an important thing. It's not perfect. It's not perfect, but that's why it's so important for everybody to get it, because the more people who have it, the fewer people that are vulnerable to
Right,
the
and
flu.
the data is really clear on that. As far as or hospitalization for pneumonia-like illness goes directly proportional to the number of people that are immunized.
Yeah.
Yep.
It's important. And there's two pneumonia shots now that people should be thinking about.
Absolutely, and that is, I think the indication is immunocompromised at any age, and then I think it's over 55, and there's certain degradations between
Yep,
there.
there's all kinds of different things that might qualify you for one of those pneumonia shots, but at 65, everybody should get them both.
Yep.
Not together. You get one and then you get the other a little bit later, but you should get them both. Wonderful. We have some questions. Thank you, people.
Right.
We have a man from Hartford who often Googles his symptoms online before going to the doctor. Are there any sites that are more trustworthy, or should the internet be avoided?
The one that I use the most, and then kind of direct patients to look at, is WebMD. I think it's pretty legit. It's pretty science-based. They put quite a bit of evidence into it, and most of it's a lot of it has to do with treatment, more so than the signs and symptoms. But it definitely would give somebody a look. Let's say if you have a cough, Google cough in WebMD and start looking at.
I like MedlinePlus.gov. That is a vetted website that's kind of like Google, but just for medical information. And so they'll search for the Centers for Disease Control and the Mayo Clinic website and the American Academy of Family Physicians and Nemours Foundations. And it's a really nice place to start. I think you have to be very careful just Googling your symptoms, because you can get an awful lot of really inaccurate information that way. So you want to be really careful where you go, and particularly if you don't have a really solid science background. And when you're just starting out with your search, it's really important to start out with those really reliable sources so that you have some basis to judge this other information on.
And the other caveat is, if at the end of it they're trying to sell you something, just get off.
Exactly.
Just leave
They're
the
trying to
website.
sell you something.
You're done.
It's probably not right.
Yep.
And as a physician, I don't mind when people come in and they're worried about something, but I want them to tell me up front so that we can talk about whatever it is that they particularly are concerned about.
And my patients have a few that will, look at their different drug options, and I think it's great. It opens up a whole new level of discussion, especially things like long-term things like the cholesterol debate and all that sort of thing. Yep.
But I do think that those drugs that you see advertised on TV, probably not the best alternative most of the time. Probably the most expensive alternative.
Yeah.
But there's often a lot of other alternatives
Are you talking
too.
about lipid?
Oh, I'm talking about everything. Skin cancer and lung cancer drugs. Yeah. All right, here we have a woman from Mitchell wonders if we could explain ALS or Lou Gehrig's disease.
I can explain it in a number of patients that I've had, that it's a terrible, debilitating disease, and they don't really have a real good understanding. There is some really different science out there. I'm trying to remember I believe it's Guam. If you were in the military during certain years, I want to say World War II up and through the 70s, that you have a slightly higher incidence Why? We don't know.
So ALS, or Lou Gehrig's disease, amyotrophic lateral sclerosis, is a degenerative disease of the nervous system. So the nerves basically progressively stop working.
Right.
You lose eventually even the ability to eat and swallow and breathe for yourself, and end up kind of trapped in your body. And most of these patients still have pretty good memory and brain function, although sometimes some of them kind of lose their edge, and it's a really difficult disease. And of course, this was the Ice Bucket Challenge a couple of years ago,
Sure.
which Dr. Holm has still never done my challenge. I challenged him and he's still never done it. So I'm going to give him a little bit of a break.
ALS also is kind of interesting when you think about it. It's the only neurodegenerative disease that I know of that the person still can walk, but they can't lift their hands.
Yeah.
Yeah.
As fate would have it, and this relates to Dr. Owens and I conversation a little bit earlier, we had originally planned on having Dr. Mitchell Penn join us via Skype from his clinic in the British Virgin Islands. Obviously, with the effects of Hurricanes Irma and Jose, he has more important things to attend to. It's a first-hand reminder that being prepared for the arrival of a disaster is important in so many ways. And to that end, the South Dakota Department of Health has an annual disaster preparedness workshop.
When there's a disaster and electronic records go down, how do you know if this person should take this medication or how they should take their medication? And so you're going to need someone to go over that with them and be able to relay information and evaluate whether certain therapies are adequate or necessary. Also, pharmacists are able to give immunizations as well. I've given many immunizations here in the past and recently, and so that may be a need at the time.
Today's our annual disaster training day for health and medical professions students in both SDSU and USD.
We have approximately 340 students today across multiple disciplines. When we initially started, we just had medical students. I believe they were secondary medical students, so we had about 50 students per class. And now it's become a yearly event, and we've now tied in a course called Core Disaster Life Support. That's half the day. The other half of the day is more hands-on training for possible deployment. A number of these students, and most years it's about a third, will sign up for Serve SD, which is a program where these students, in case there was an influenza outbreak or something like that, where we need to have force extenders, where these students, these partially trained healthcare profession students, could then go back to their hometowns and help out the local providers.
A unique experience to have all these different disciplines of pharmacy, occupational therapy, PTs, medical students, what have you, to kind of be prepared for any, disaster that would come up. So it's nice that we have that opportunity to participate before something like that would happen, and so that we're kind of ready for that event. And if anything would happen, we're actually able to be mobilized and useful.
The first part of the day for half of the students is what we call Core Disaster Life Support, and that's a national curriculum for health professions on disaster life support functions. And then the other half of the day is made up of a series of breakout sessions, and those are more specific to South Dakota issues that we want to train on. They range from psychological first aid to immunizations to anaphylaxis and the use of auto-injectors. We also have a session on triage, points of dispensing, and that's a mechanism where we plan and train to dispense pharmaceuticals or vaccinations to every man, woman, and child in the state within 48 hours.
Actually, Core Disaster Life Support is a course designed for all people that would be involved in a response to a disaster, people like emergency management, ICS type people. I think it'd also be a very good course for, like, say, the emergency managers at the county level to take it. If nothing else, then they'll know what those students that may be deployed back to their home counties, what the curriculum they've been through.
Mainly it's an awareness of the disaster response structure and then an ability above and beyond what they had when they came in today to assist in a response to a major disaster. as a medical profession student, they have skills above the rank and file person on the street. And with the guidance of a physician or the guidance of a nurse, they can extend those skills to a greater population in a disaster.
Department of Health as the Emergency Support Function 8, that's the public health and medical support function. We're the lead agency, and we've been working with hospitals, healthcare, EMS, local and state emergency management, even some of our federal partners at Health and Human Services to put together a medical surge plan so that if we have a mass casualty incident, we have the resources and the training and the communication, the plans, all those necessary elements to respond to that and to actually support the local organizations that are responding, that are dealing with that.
I'll tell you, there is one thing that's very interesting about it, is that it is a cooperation between the Department of Health, the state, the medical school, practicing physicians, the medical association. You don't get in very many states cooperation from everybody that is responsible for any kind of health care disaster management. So that makes our state of South Dakota special.
Just before we went live tonight, Dr. Holm heard from Dr. Penn, who was supposed to be here with us via Skype, but is in the British Virgin Islands. And he reported that they're in need of many things, including roofing materials and diesel generators. If you'd like to help, you can contact the British Red Cross. So Matt, the little roll-in that we just saw here, that little clip, that was shot about two and a half years ago now. So can you update us on that program?
Yeah, we're expanding. We've, once again, as Dr. Luzier put it, we're the only state in the nation that does this. We train now across 11 different disciplines, 4 different universities involved, and we've expanded into the training program even here at SDSU with the nursing department. The PharmD students also come down to USD for training. In the future, we're also adding Northern and a number of other clinical training sites for RNs across the state. So I would guess within the next year and a half, if you're a medical provider, whether you're an occupational therapist, a physician, a PA, anywhere in that whole broad spectrum, you will have some basic disaster training. And our program just continues to grow and become more robust.
That's fabulous. It's a really worthy
It's also
program.
a lot of fun.
I bet. So we have gotten some more questions, and people keep them coming. We love questions. This is a man from Alchester who asks, does the lack of sexual activity have an effect on the testes or other male reproductive organs?
No.
I'm sure he's disappointed in that response.
It's just no.
Actually, it tends to go the other way. So if there's testosterone deficiencies or even just aging, we'll often see that in a decrease in sexual interest or a decrease in sexual ability, maybe would be a good way to put it. So.
And the other thing to think about too, men and women, if you have a decrease in libido, you do need to see your primary care physician about it. There's other things that cause a decrease in libido than just aging. I mean, depression is one of the
Depression is huge, huge. Medication sometimes can cause problems too. So definitely talk to your doctor about it. Being busy is probably the most frequent one I see, especially in women. So. Here's one from a woman in Sturgis who suffers from allergies in the early summer and wonders if allergy season causes increased fatigue for people who have allergies.
Directly. Well, I think a lot of the symptoms I see with allergy sufferers, if they're not treated correctly, either with immunotherapy or if you can get by with just an over-the-counter and some nasal steroids, is it so affects the upper airway that it affects sleep in such a negative fashion that it's almost becomes almost like obstructive sleep apnea. But it's due to the inflamed tissue. They just can't breathe through their nose.
And some of the medications, particularly the over-the-counter, the first-generation medications, are very sedating. You know, Benadryl, everybody thinks about that as an allergy medicine, and it is a good allergy medicine, but it's also very sedating.
Yeah.
That's the secret ingredient in Tylenol PM, people.
Absolutely.
So if you're tired and you've taken Benadryl, that might be a reason. So there's another one here. A woman from Huron who asks what diet you recommend for those with colitis.
I'm going to punt.
All right.
I'm going to punt that.
All right, I'll take that one. So one of the issues is that colitis is actually not one disease. I mean, there's a variety of different things that kind of get called colitis, and some of them have dietary issues that you might need to be aware of, particularly what we call celiac disease, gluten-sensitive enteropathy, and that's a disease where the people who are affected by it have to be very, very meticulous to avoid gluten, which is in wheat and beer and often injected into turkey and just in a huge variety of things, even vitamins that you would not necessarily think might have it. So that's a condition where you really do have to be aware of it. There are other allergy type related processes that some people might refer to as colitis. As doctors, when we're talking about colitis, we're often talking about like ischemic colitis, where the gut doesn't get an adequate blood supply, or something like Crohn's disease or ulcerative colitis, where the immune system is attacking the gut, or infectious processes. And in those, you don't necessarily have to think about dietary changes. Some people will find that they feel worse if they eat milk or something like that, but scientifically, there's not a huge role for diet in treating those.
One of the things I also bring up, and always kind of going after that public health message, make sure you have colitis. I wouldn't even think about that diagnosis without an endoscopy, without a colonoscopy.
Yep.
The other thing
or CT, sometimes we can see the inflammation.
Sure.
Or
have it evaluated. The other thing, when people just come in with vague symptoms and they've had a negative colonoscopy, kind of one of the general rules, keep it simple. If it comes out of a can, a bag, or a box, don't eat it. And amazing the number of people whose whole GI systems improve by shopping the vegetable aisle and not in the canned aisle.
Right.
Yep.
Right. Well, frozen vegetables are okay too, people.
Yep.
Especially if you don't have a lot of sauces or seasonings on them. All right. A woman, this is a good one. A woman from Sioux Falls asks, where does sepsis come from? Can it come from a stomach bacteria, and can it recur?
Sepsis is a term that basically you have an overwhelming infection in your body, and it basically has to do with the fact that your cells aren't getting what they need, whether it's oxygen or whatever. And there's a marker for it called lactic acid. And since the days when you and I are in residency versus now, our markers are so much better. We're trained so much better to pick up on it because it's a life-threatening illness.
Yeah.
Now, for where it comes from, that becomes a whole nother multiplicity of sources. It can basically come from anywhere.
Sepsis does not mean a particular organism.
Right.
Sepsis means that there is an infection somewhere that's overwhelming your system, and maybe your blood pressure is falling, or there's all kinds of different things. It is a big emergency, and it's something that needs to be acted on very quickly. The infection might be starting in the kidney, it might be starting in the lung, it might be starting in the skin. It could be starting in not so much the stomach, although sometimes if you have an ulcer that perforates and breaks all the way through the stomach, you can do that. But more often in the intestine, we'll see people have an infectious process there that can spread and cause sepsis. So it's a very serious illness, and it can recur. It often happens in people whose immune systems are not very strong in the first place, or who have other chronic illnesses, and those problems don't go away just because they've had sepsis once. They're still vulnerable to that infection again. So, it's
and
a good
if in
question.
doubt, always talk to your doctor about your teeth.
Good.
If the doctor hasn't figured it out, if you had any dental issues, it's something I usually have to checklist to ask about.
Yep. Yeah, dental care is a very important part of healthcare. So get your teeth fixed. Go to the dentist, everybody, after you get your flu shot.
After you get your flu shot.
A man from Pierre, speaking of which, asks, when does flu season start and how long does the vaccine last?
Which continent?
And that's the important part. flu is seasonal, and we tend to see it a little later here in South Dakota than they do in Florida or some of these other places. Flu is all year round, but it just depends on where you are when it moves. We tend to see our flu season in the fall and winter.
Yeah, the timing of the flu vaccine, that's always been quite intriguing. And when you talk with the folks at the CDC, and I get it, their take home is they want everybody to be immunized. The answer that they would give you is when you can get the vaccine, you get the flu vaccine. But we have this discussion with the other physicians and providers at my facility, because it seems like we see our significant influenza is always much later than usually we used to think, say, January. Now it's more like February, March most years.
And yet I remember not too long ago I was seeing it around Thanksgiving.
Yep.
So it is somewhat unpredictable when it's going to start, but typically you see it somewhere between November and April, May.
Yeah.
So that's not very specific, but it changes from year to year and
Yep.
place to place.
And
So-
with increased international travel, it's
Yeah.
like we saw with H3N1. It
Yeah.
can be in the middle of the summer.
Yep, you
Yep.
can see it pretty much any time. In terms of how long the vaccine lasts, when you and I were residents, we'd say, oh, you get about 3 months of protection from that. And now the CDC is actually saying that you get a good 8 months
Yeah.
or longer of protection. So we typically remind people starting in about October here in
Yep.
South Dakota, but you're not wrong to get it before then. So, all right. A man from Sioux Falls asks if there's a maximum amount of oral calcium that one could take before you get calcification of your arteries.
To my knowledge, those two things, unless you have a specific endocrinopathy, probably are not related,
Right.
because the extra calcium is going to end up in the stool,
Yep.
one way or another.
Yep.
So I don't think we can make the correlation between oral calcium and coronary disease.
I would agree with that. We talk about calcium in the arteries and coronary artery disease, but that's kind of a byproduct of
Yeah.
the plaque building up, and that's not the primary problem. It's just how we can help detect the problem.
Right.
So having said that, you don't need to take massive amounts of calcium, and it's best if you can get that in your diet. So there's all kinds of different ways you can get it in your diet. Almonds, salmon with bones, a lot of vegetables and legumes will have it. And of course, dairy products are kind of the mainstay around
If
here.
you can tolerate milk, there's a reason you should be drinking
Yep.
it. Yep.
You can be drinking milk.
Yep.
And there's a lot of milk substitutes, soy milk and almond
Sure.
milk, that have a lot of calcium in it too. So
One of the reasons I think that question probably came up is now with the advent of calcium scoring. And once again, I don't believe there's any relationship there between dietary intake.
yeah, I don't think so too. So, and then now here's a question that's probably close to our hearts. A man from Sioux Falls asks, at what age should one think about switching from their primary care physician to a geriatric physician?
Well, first check to see if your primary care physician does geriatrics. That'd be the first question. And I don't know how many boarded gerontologists we have in this state. I really don't know. But the majority of the family docs that I worked with over the years that are practicing rural medicine, and Brookings is rural, are really quite well trained in geriatric medicine. I don't think there's really a defined date there, if
No.
ever a date.
I don't think so either. I think family practice, internal medicine, who
Yep.
is going to be the people seeing the vast majority of adult patients, are very comfortable taking care of elderly people. Internal medicine doctors, that's all they do, is take care of adults, and a significant percentage of their patient population is going to be elderly. Family practice doctors also take care of children, so we may see a slightly skewed age group there. And every doctor kind of has their own thing that they like to do best. So maybe your doctor only likes to take care of kids or younger people,
Right.
and maybe your doctor really likes to take care of old people. I think you have a very old patient panel.
Yes, I do. I'm a medical director for 2 nursing homes and love it. It's just, it's what I do. Yeah.
Yep.
One of the things I can add on there is this question may be coming for somebody that might be looking at maybe long-term care placement or
Right.
that kind of thing. One of the things they need to talk with their physician, especially if they've had a long-term relationship with that physician, is going through a thing called a POLST form, Physician's Orders for Life-Sustaining Treatment. As we age, you're what you want for your health care, how much intervention, how much invasive things you want done. It's a lot easier to talk about it in the clinic before the memory starts becoming a problem, or before all these other things start becoming a problem. Before a crisis happens,
Yeah.
and get a family member or two in on that discussion.
Yeah.
And that form is not a withhold care form, it just documents what that person wants when they're unable to tell you.
Yeah.
Yeah.
Yeah, and that's an incredibly important thing for everybody. So, time for one more quick question before the next little video clip. A man from Madison is 74 years old and wants to know what is the appropriate time to get his flu shot and when or should he get a pneumonia shot. And we've touched on this a little bit here. So, flu shot, October, but if you get it earlier, don't worry about it. Pneumonia shot.
Actually, in my clinic, the nurses handle that, and they keep a kind of running tally. And I don't
who's due.
Exactly. So
at
at 74, I think tomorrow might be a good day.
Tomorrow,
Yeah.
I agree. But check with your doctor because you may very well have had them.
Right.
If you have not, at 74, you need 2 pneumonia shots, the Prevnar and the Pneumovax shot. So talk with your doctor if you haven't had it. You need it.
And the Zostavax.
And the Zostavax. Definitely think about getting
Yep.
the Zostavax so that you don't get shingles. That's an important thing. A woman from Huron had LASIK eye surgery 10 years ago and is wondering if sensitivity to light is a common side effect of the procedure and if anything can be done.
Outside of what I do for a living, that's way above my pay grade. I don't know that answer.
I have heard a lot of patients talking about sensitivity to light after that, but I have to agree too, I do not know what the eye doctors can do about it. So my recommendation would be call the ophthalmologist that did the procedure for you and talk with them. That's a good thing. So, all right, everybody, if you are traveling out of South Dakota for the winter, you can still watch On Call with the Prairie Doc live via Facebook.
Starting this season, we are offering a Facebook Live option for our viewers to still be able to watch the show during the regular broadcast times on Thursday nights and ask questions. All you need is either your laptop, tablet, or a mobile device, such as your smartphone, to view the show. Here's how to do that. First, log into your Facebook account. If you don't have a Facebook account, go to facebook.com and complete the information to create an account. In the search bar, type in Prairie Doc. Make sure to click like on our Facebook page so you can get updates and notified when we are going live. Each Thursday on the Prairie Doc's page, you will be able to see a live broadcast of the newest episode. You can also ask Dr. Holm questions via Facebook Live. All you have to do is ask your question in the comment bar and await a response. If you miss a show live on Facebook, it will be available later both on the Prairie Doc Facebook site or at prairiedoc.org.
So I don't know how many patients you have that are snowbirds, but I have a lot of patients who are snowbirds, and I'm really excited to hear that they can still watch this program wherever they are via Facebook. So that's a great thing. Dr. Holm does a wonderful job with this show.
He sure does.
Yeah.
You bet.
A man from Chester would like to know how soon after a mosquito bite will you see symptoms of West Nile, and what symptoms should you watch for?
Well, the majority of people that get West Nile never know they have it. Is the incubation time I've read anywhere from 6 to 14 days. It's whoever you want to believe.
I don't know very many people who can say which mosquito bite it was
Exactly.
that gave them West Nile. So, the symptoms can be very variable from the people that are really, really sick in the intensive care unit to, as you say, people who never even knew they had it. Maybe they feel a little achy or tired for a few days and then they're fine and they never think anything of it. So the symptoms that make me think about West Nile are particularly the neurologic symptoms, the headache, the high fever, the not quite connecting mentally, but people will have a lot of body aches and maybe some respiratory symptoms, although those aren't real common. Maybe some stomach symptoms, some diarrhea, but
A lot of what I've seen is folks that just kind of have a nagging headache, and like you said, it's just not, they're not operating on all 8 cylinders.
Yeah.
And then by the time usually we get the West Nile serologies back, the
They're
vast
fine.
majority are doing great. So
Yep.
that's good news.
And I think that that's an important thing to recognize, is that even though this can be a terrible disease, at least until we get a vaccine, just keep your mosquitoes down. That's about
Yep.
all you really need to do. So, another mosquito-borne virus that we've been hearing a lot about lately is Zika.
Yeah.
What can you tell us about Zika, Dr. Owens?
Unless there's a huge climate change, not issue if you live in South Dakota.
South Dakota.
That-
Well, except for travel.
well, travel.
Yeah.
But you should be following the same thing as we do during West Nile season if you're in Florida, where Zika, and I think it's the south tip of Texas, has had a few cases. You know, the standard precautions: long shirt, bug juice, spray, and don't be out in the evening when the mosquitoes,
are
active.
out.
Yeah.
And the people that really need to be considering this, really need to be thinking about this, are women of childbearing potential.
Absolutely.
Because the disease is most devastating for developing fetuses.
Yeah.
So if you're contemplating a pregnancy, if your partner is contemplating a pregnancy, you're going to want to be extra careful
Yep.
about that.
And the male also.
And the male also,
Yep.
exactly,
Yep.
because it can be transmitted via semen.
Yep.
So, yeah. A man from Volga wants to know our opinion about taking vitamin B for various ailments.
Oh, I would say spend your money elsewhere.
Unless you have a documented B
Right,
vitamin
unless you get,
deficiency,
B12
or
deficiency.
if, for example, you've had certain GI surgeries, gastric bypasses,
Right.
and those kinds of things. For the most part, I don't think there's a lot of benefit to taking high doses of vitamin B. A general multivitamin,
Sure.
I don't have any objection to that. Vitamin D, I think most of us don't get enough, especially now that we're so careful about sunscreen. But
Right.
B vitamins, save your money. Oh, a woman from Brookings asks, what are some tips for finding a new primary care doctor and specialist when relocating to a new area?
Not sure how I'd answer that one, because I don't do social media, but apparently there's quite a bit of stuff out there. Trusted sources, friends, etc., about who they've had a good clinical experience with, I think probably be a first place I would look.
And it's certainly if you know nurses that maybe work at a
Absolutely.
hospital, they maybe are going to have a bit of an in on the different personalities that doctors
Yeah.
have and who might be a good match for you. Here in Brookings, our specialist opportunities are somewhat limited. A lot of our specialists come up from Sioux Falls. We do have a handful of specialists that are here in town, but I imagine that's even more the case in Redfield.
Yeah, we have cardiology and orthopedics
Do they do
and
outreach?
oncology. Yeah, oh yeah.
Yeah.
Yep.
Yeah.
But that's actually, the patients don't necessarily pick that specialist. It's usually, what I try to do is line up what I think who's going to offer the best care for that individual.
Yep.
Yep.
And who the best personality
Yeah.
match is going to be, which is a big part of it too. So, a man from Watertown has gone through chemotherapy and has neuropathy in hands and feet. Do we have any ideas as to what might relieve or help the symptoms?
I would still check a thyroid
And a blood sugar.
and a blood sugar. And kind of the go-to right now for me in my clinic, cost-wise, is gabapentin.
Gabapentin, yeah. There are certain medications that can be extremely helpful for nerve pain. Gabapentin or Neurontin, which
Lyrica,
is
yeah.
an old seizure medicine that doesn't get used very much for seizures
Right.
anymore. Its daughter compound, Lyrica, which is a little more expensive. And then I use an awful lot of a medication called Cymbalta or duloxetine, which
Yep.
is a depression medicine originally. And so there are some things that can be done. I've had some patients who've had some success with acupuncture. And talk to your oncologist and talk to your primary care doctor. They may have some options for you. All right. A woman from Sioux Falls was diagnosed with a cyst in her breast and is wondering if that could turn into non-Hodgkin's lymphoma.
My gut response would say I don't think there's any
No,
relation
you
there.
don't have to worry about that. Cysts in the breasts are really, really common findings, and they're basically fluid-filled collections in the breast. The breast is a very glandular tissue, and it's not at all uncommon to see cysts there. Simple cyst, sometimes the radiologist, depending on what it looks like under ultrasound, may want to keep an eye on it, but there's no connection between that and the lymph system. So
we want to make sure that that's what she was
that's
told.
what it is. Yep,
Yes,
exactly.
yeah.
We want to be sure that it was a cyst and not a lymph node in that breast.
Yep.
So, a 61-year-old man from Beersford is wondering if a lack of sexual activity encourages prostate problems.
I think there's kind of a reach going on there, and
We seem to have a theme going
I
here.
don't know. This isn't the men's health. We've done that one before. No. The answer is no.
A man from Belfarouche is on 8 different medicines and wonders if that's too much.
The question is, what are the 8 medicines and why 4?
Yes.
And there's a thing called polypharmacy. If you're seeing a variety of different physicians, you really need to make sure you've got somebody, primary care, that's part of our job, to make sure we're not giving pills to fix pills.
Yeah. Or 2 pills to do the same thing if one will work. So the answer to that is maybe and maybe not. It kind of depends on what the medicine is, what it's for, but it's definitely worth sitting down and talking with your doctor and saying, hey, can we get rid of any of these?
And the other thing to bring up on that too is with the variety and the vast amount of pharmacy we have available now, I think it's important for folks to, in Redfield we have a local pharmacist, and bring all those pills in that you get filled and make sure, in other words, if you're getting some meds from some retail store here and some from another one, I would make sure also for the drug interaction thing, it probably behooves you to shop
at one place. I agree. A woman from Worthington asks, could you give me a synopsis of gastroparesis? How can you get it, and what foods can you eat if you develop it?
Most of the folks that I see with gastroparesis, it's a side effect of their diabetes.
Yeah.
And it basically just means that his stomach does not empty. They have delayed exit time into the small bowel. There's some meds that can help, although they're not all that great. I don't know of any food items.
What I'll often do is have people do a low residue diet. Foods, cook your vegetables as opposed to raw vegetables. Soups can be helpful because they're just easier for the stomach to get rid of. So things that are heavy, things that are slow to digest, things with a lot of fiber in them. It's a really, really miserable problem for the people that have it.
Stay away from ribeyes. Yeah.
Stay away from ribeyes. A man from Sioux Falls was told by a doctor that he should get the flu shot and walk fast every day for half an hour. He can't get the flu shot because he is allergic, and he can't walk fast because he has arthritis. What are his alternatives?
Stationary bike.
Yeah. Stationary bike, recumbent bike can be really helpful. Water activity can be really helpful.
Unloads the joints.
Unloads the joints. The other thing that I'd like to say is it's actually extremely rare not to be able to get the flu shot.
Yeah, and I think a lot of that has to do with some of the a lot of the viruses, we call them viral exanthems. People get a rash. They also say they're allergic to amoxicillin, they're allergic to antibiotics. It could have been the timing.
Yeah.
In other words, they had a flu shot where, in fact, they had a flu shot where the real problem was they had an underlying virus that was not recognized.
Yeah, so I would be very hesitant to tell somebody that they couldn't get the flu shot because of an allergy. Even people that have allergies to eggs, an awful lot of them can get the flu shot, even though that flu shot is percolated, kind of brewed in eggs.
Yep.
So I would talk with your doctor if you're really afraid about what happened when you got that flu shot and why you think you shouldn't get it. So, a woman from Tyler, Minnesota wonders if we could talk about Baker's cysts.
Sure. It's inflammation. It's usually the back of the knee.
Yep.
A lot of it has to do with wear and tear within the joint itself.
Arthritic.
And anti-inflammatories can help. Basic just joint protection tends to help. Some folks do need to go on to have it drained or removed.
Scoped.
Or scoped.
It's basically like a ganglion cyst that a lot of people have in their wrists. They might call them Bible bumps, and you have a sac of fluid that buffers that joint. That's like a shock absorber in that joint. And what the Baker's cyst happens is you get some of that joint fluid that pooches out.
I was going to use the word pooch.
Pooch, that's a good word. It's a good medical word.
It's a South Dakota medical
Exactly,
word.
exactly. So it goes between those two big tendons and forms this bulge back there, and it can be pretty uncomfortable.
Yeah.
Sometimes a steroid shot in the knee can be helpful. I love physical therapy. I love sending people to physical therapy for arthritis problems. It can often be really helpful.
Yeah, that's my number one referral for people with degenerative joint disease. Therapist, no side effects.
Yep,
no
exactly.
kidney problems. Yeah.
No side effects. A woman from Sioux Falls asks, what medicine is good to take for sleep apnea when you have Parkinson's disease? A CPAP machine.
CPAP machine, yes.
There's really no
Absolutely.
medicine that you can take for sleep apnea, no matter what else you have. Your options are the CPAP machine, which is the best option. Some people can wear a dental appliance to
Right.
kind of pull the tongue forward, and then there's a few really almost experimental therapies that involve shocking the nerves and those kinds of things. But the bedrock treatment for sleep apnea is a CPAP machine.
Right, and if you're not getting along with your mask, then you need to get back into whatever facility that initially you got the mask and look at things like nasal pillows.
Yep.
Look at some of the alternative ways.
There's a lot of different masks
Yeah.
out there, and most people, even people that are claustrophobic, can actually find a mask
Yeah.
that they can wear. They've got some that instead of coming off the face, now come off the top of the head, so you don't have nearly as much in front of your eyes.
Right, and then also with the auto titrate features, you don't have that immediate pressure response that a lot of my patients don't like. With
Yeah.
auto titrate, it just takes it up to where you need to be.
Takes it up a little slower.
Yep.
They even have soft cloth masks now, so there's all
Yeah.
kinds of different things. It's really neat. A woman has had plugged ears and a stuffed head for 3 months. They did a CAT scan and an MRI and found nothing. Why is she so congested?
I would back that up and say what
Why
is
did
her
she-
exposure, where did it start, what has been tried before I
Yeah.
would jump to the diagnosis. If you say it started about the time they started doing wheat, whatever the wheat, where I'm at, it's usually dependent on, like kochia, once it starts flowering.
What's blooming, what's
Yeah,
flowering?
yeah.
I guess the question I'd ask, boy, it's not common that we do an MRI for plugged ears and stuffed head. So I think that her doctors may be thinking that there's something else going on.
Yeah.
Most of the time, stuffed nose, plugged ears is an allergy or an irritant project. If she has it and her doctor doesn't have any objection, I'd say a neti pot would be a really good thing
Sure.
to try. Nasal saline irrigation.
Yep. And if they have a cat, that's usually what the problem is.
And there's shots for that. And
No,
for
yeah.
you. All right.
You shoot cats?
And now, for the winner of tonight's Prairie Doc quiz question, which was name 3 of the top 10 medical conditions for those older than 65. The possible answers are arthritis, heart disease, cancer, lung disease and infections, dementia, diabetes mellitus, falls, substance abuse, poor oral health, and shingles. It was James Thompson from Sturgis, South Dakota, who answered the question correctly. Thank you, James, for participating, and a book will be in the mail to you soon. We'll be right back after this.
West Nile virus is a potentially serious and even fatal disease that is transmitted by mosquitoes. The virus is already here in Brookings County and people have gotten sick this summer. It's likely that there will be more cases in August and September. The best way to avoid West Nile virus is to protect yourself against mosquito bites. The risk of transmission is highest in the evening and at night, so be sure to use mosquito repellent and wear long sleeves, particularly if you are going to be outdoors late. If you take these simple precautions, then you shouldn't have to worry about getting West Nile virus.
I love to talk with people about protecting their health. We talk about staying safe, eating right, staying active. We talk about cancer screenings, keeping diseases under control, and quitting smoking. Perhaps most importantly, we talk about shots. Vaccines are one of our greatest public health accomplishments. Talk to anyone who remembers the 50s to hear how polio terrorized the nation. My own father nearly died from whooping cough. Misinformation about vaccines abounds. People think we don't need them anymore. Those diseases are defeated. People think they overwhelm the immune system. People think that their protection is perfect, so the immunized shouldn't care if others aren't. None of this is true. In our modern world, diseases may be only a plane ride away. Remember the 2015 Disneyland measles outbreak? Or the 2009 influenza pandemic that killed thousands in the US alone? Other diseases are always lurking. Tetanus spores live for decades in the soil. Vaccines give the immune system a chance to practice, so that if the infection is encountered, it can be quickly recognized and defeated. Many modern immunizations contain only a few bits for the immune system to learn. A baby born today may have shots against 16 diseases compared to the 8 his mother got, but the total number of those bits has decreased. Every day his environment bombards him with thousands of similar bits. His immune system is more than capable of handling a few more. Vaccines aren't perfect. Some people's immune systems don't learn the lesson. Some children are too young for a vaccine. Other individuals can't get them due to illness or allergy. Herd immunity is important. Surrounding someone with immunized people protects them because the disease can't get close. Anyone who can get their vaccine should. It's how we protect infants and the ill. Immunizations aren't just for children. Adults need them too. There's the annual flu shot and the tetanus booster. There's also a whooping cough shot. If you've had chickenpox, consider the shingles shot to remind your immune system about the virus. You might still break out in the rash, but the pain is less likely to linger. We have 2 pneumonia shots for adults. In fact, the story of the second shot demonstrates that herd immunity. When we gave it to infants, their grandparents benefited. The bottom line is this: vaccines are a great scientific success, and getting your shots will help you, your family, and your neighbors stay healthy. A big thank you to our guest, Dr. Matt Owens, for traveling to our Brookings studio in the Yeager Media Center. His experience and discussion added so much to our show tonight. Our thoughts are also with Dr. Penn and the British Virgin Islands and everyone affected by the recent disasters. West Nile virus continues to be a concern here in South Dakota. Here's this week's numbers. 55 human cases of West Nile virus disease have been reported to the South Dakota Department of Health. About 35% of cases have been neuroinvasive disease, 65% have West Nile fever, 44% have been hospitalized, and 1 person has died. We'll need to take precautions until we get a hard statewide freeze. State epidemiologist Dr. Lon Keitlinger also reminds us that October is the optimal month to receive the flu vaccine. Too early and the effectiveness may drop off before the end of the flu season. We've had more questions than we could answer during the broadcast time of tonight's program. To watch our answers to the rest of your questions live, go to the Prairie Doc Facebook page. And that does it for us tonight. From all of us here on Call with the Prairie Doc, until next time, stay healthy out there, people.
Is your shoulder to blame? We'll discuss shoulder problems and solutions next time on Call with the Prairie Doc.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota, and with the ongoing support of these individuals and institutions, Brookings Health System, Ophthalmology Limited, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Aberdeen District Medical Society, Black Hills Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinics, Community Service Committee, and Swiftel Communications.